Hey everyone, welcome to KSSP Podcast. I am Spencer,
And I'm Katie.
and today we are going to be talking about diabetes type 1. To begin, we're just going to kind of go over a little bit of the normal function of some of the organs involved in diabetes. Then we'll go over a little bit of the pathophysiology and then what you can use for treatment. So that's how we're going to start. And then after that, we got some other things we'll go over, but we'll just get started with the pathophysiology here, or physiology. So to begin, we have the pancreas, and I'm just going to kind of go over the normal function of the pancreas, or not necessarily the whole function of it, but just the important aspects and how those will be affected in diabetes. So the pancreas, the two cells that we're going to be looking at here are our beta cells, which I'm going to make a square, and then our alpha cells, which we're going to have to be a triangle. So the beta cells are important because they produce our insulin, and then the alpha cells are important because they produce our glucagon.
Yeah, and then they
So,
have opposite functions too. So the insulin is going to help lower your blood sugar, and the glucagon is going to help raise your blood sugar so that it can stay balanced.
yeah, so that's the normal function of the pancreas. And then another important organ to look at is the liver. So, this one is important for the glucagon. That's, I think, is that Jupiter? Glucagon is gonna be Jupiter, guys. So we got our glucagon here, and it interacts with the liver and it goes through a process. Simplified, it will then produce,
I do want to
where's,
mention that that planet is Saturn.
oh, is it?
Yeah, that you picked, but it's fine. It'll represent the same thing.
So we got our glucagon here. It interacts with the liver to produce glucose for the body. Okay, that's not glucose. What are you spelling there?
Glucage.
To produce glucose for the body. Again, this is very simplified. I understand that, but the basic is that the glucagon interacts with the liver to help produce glucose energy for the body. And then another important function that we are going to look at here is, I think I made insulin Earth, or I hope you don't correct me, and I hope this is Earth, but
There you go. It is Earth. Beautiful.
so we got our insulin here. It will interact with receptors on certain cell membranes. And then again, it's there's a process that happens, but the simplified version is that it kind of opens barriers almost, I would say, in this cell that allows the glucose to get into the cell, giving the cells energy.
So is the cell between those two green lines, those two big green lines?
No, this is the membrane.
The membrane.
The
Okay.
cell membrane, yeah. So the cell is over here and then the blood.
Oh, okay, so that's the barrier.
Yeah, this is the
Okay.
yeah, membrane barrier. And then this is like the simplified version is that the insulin interacts with the receptors on the cell membrane, and then that allows a transport of the glucose from outside the cell into the cell, giving it energy, giving the cells energy. So that's the normal, what we want our body to be doing. And then over here, so this is the T cells, and the T cells usually there's a process, I forget, I think it's like self-regulation basically the T cells don't normally attack the human body. But in type 1 diabetes, there's a genetic abnormality that doesn't allow them to understand not to attack the body. So the T cells over here are going to kind of gang up on the pancreas and attack the beta cells, which makes it so that the pancreas is not able to produce insulin anymore. So as you saw, how the body functions normally, and then in type 1 diabetes, the T cells will attack the pancreas, which attacks the beta cells, which means that the body can't produce insulin. And as you saw, if there's no insulin, then the glucose cannot get into the cells. And when that happens, the cells, in a sense, starve, leading to one of the big symptoms of type 1 diabetes, which is polyphagia, which is just kind of increased hunger, because even if you are eating a normal amount or what you should be eating, you're still going to be hungry because your cells are starving. And then they are also going to start breaking down, either if it's protein or fat tissue. Basically, they're going to try to start breaking down what they can so that they still have energy. And then another big symptom with type 1 diabetes is glycosuria, which is glucose in the urine, because again, the glucose doesn't really have anywhere else to go because it can't get in the cells, so it's being excreted in the urine. And
Now,
since,
sorry, are those the same
oh,
as
you're good.
ketones?
No,
Or are they
I
different from
think
ketones? Okay. Because I know I've had ketones in my urine before.
I want to say ketones are different.
Okay.
Because I think, because isn't that with ketoacidosis, diabetic
Often,
ketoacidosis?
yeah.
I don't think it's because of the glucose. I think that is because the byproducts of what the body is breaking down, trying to get energy, because it doesn't have energy.
Oh,
So
okay. That
like the
makes sense.
protein, because you can have protein in your urine, and then
Hmm.
like your cells are breaking down, trying to survive because your body isn't able to get the glucose into your cells, so they're breaking down, and then those byproducts, I think, are, again, I would have to double check, and someone can fact check me if I'm wrong, but I believe that is what ends up being the ketone bodies. And there's probably, again,
Okay.
that's a simplified version, but
Makes sense though.
yeah. Then there's glucose in your urine, because again, glucose just sitting in your body doesn't have anywhere to go, so it can get excreted in the urine. It's again probably a very intricate process on how that happens, but that does happen. And then because the glucose is getting excreted in your urine, I believe glucose is osmotic, so it's going to pull water with it, leading to polyuria, so increased urine. So not
Hmm.
only do you have glucose in your urine, you're also peeing a lot more too.
Yeah,
And
and drinking a lot more.
yes, that's the next
Stay
one.
hydrated.
Since you,
Yeah.
yep, because you're peeing out all that urine, you are also dehydrated, leading to
Hmm.
polydipsia, where you're consistently thirsty. So you're going to be drinking a lot more and peeing a lot more and always hungry. So those are some of the big symptoms of type 1 diabetes. There's probably a bunch of other symptoms as well, but those are the ones that, especially in nursing school, they really emphasized in us.
Hmm.
And then the one other thing that I just wanted to talk about was not in depth, but just treatment for type 1 diabetes is lifelong insulin therapy.
Yep,
And
for type
there's,
1.
yes, for type 1. And there's a bunch of, I assume all the different, because I know there's different devices. So you can do
Yeah.
like injection with a needle, or I know I've seen like some on the arm, or
Yeah, there's
seen someone have it on their
Omnipods.
butt or
The
something like
Omnipods
that.
are the wireless insulin pumps, and that's what I'm trying to get. And the other types of insulin pumps usually will have like a tube that connects to your body that connects also to the pump. So there's different types of insulin injections you can do, or you can just inject with needles too. But that's not a very popular method, even though it's what I currently do.
Is that the method that most, like when you're first diagnosed, everyone has to, or can you
Yeah.
automatically go to one of the
Well,
other?
times have changed, so I don't know exactly how they do it now. But when I was first a diabetic 15 years ago, they had me on the needles first because they want you to create a routine before they give you the pump. And they want
Okay.
you to have long acting insulin and short acting insulin, which is really only done with needle injections. It's not done with insulin pumps. With insulin pumps, you're only receiving one type of insulin, which can increase your risk for ketoacidosis if you lose access to that insulin. Whereas with the long acting, even if you lose access to your short acting, like you'll still have the long acting for the day to help you out.
That makes sense.
But that's how my doctor is. Some doctors are more lenient. My doctor wants me to get my blood sugars down before they give me a pump, but a lot of doctors will just say, you learn the routine with the needles, so like the pump is going to be easier in the long run, and you're going to be more likely to give insulin with the pump because it's easier. It just really depends on what doctor you're seeing.
And aren't there some devices that you don't even have to measure your own blood? Like it does the measuring of your
Yeah,
glucose
like,
for you, and then
do I
the
still got it on?
administration. Oh, you have
I've
that
got my
kind? Oh,
glucose
okay.
sensor on. Yeah, my
So does
sensor.
that give you insulin, or does that
No,
just
that just
measure?
tests my blood sugar.
Oh, okay. Do you still have to sometimes double check just to ensure accuracy, like check it
I'm
still?
supposed to, but I really don't.
Oh, okay.
But I mean, I trust it and it hasn't really steered me too wrong. I mean, I feel fine with it.
Yeah.
So, and like when I see the blood sugar, it's about how I feel. So,
Okay. Yeah, it's just cool, interesting how there are so many kind of different options for treatment, like
yeah.
outpatient. Because obviously, inpatient, there's also IV insulin, but that is only if you're critically sick, and we're
Yep.
not going to be giving that outpatient. So,
Right. And I've had that before when they
yeah,
just do IV insulin because your blood sugar is so high.
yeah, it's a very intense process, especially like working as the nurse with it. It's a very intricate, intense process, and very can be very dangerous too, obviously. Just insulin in even like if you inject probably too much insulin at home, that's still
Mhm.
very dangerous too.
Yes, it is.
But I think that was all I had for physiology or pathophys, like just kind of the explanation of our short and simplified explanation of diabetes. So,
I'm going to share a little history and go over some tips and tricks since I am a type 1 diabetic. So, I've been a type 1 diabetic for about 15 years now. A funny story here. When I first got diagnosed with diabetes, it really hit me my self-esteem because I was 11 years old, and the only time I'd ever even heard about diabetes was for erectile dysfunction commercials. So I basically thought I was like a fat old man,
oh
pretty
no.
much, until they explained it to me that that's not how that works at all. The other really big event in my life with diabetes was I went into a coma in 2020, August of 2020. I was in a diabetic coma because I had caught pneumonia without realizing it. I passed out. Luckily, I had roommates who found me eventually, and they took me to the hospital. My blood sugar was over 1600, which it's supposed to be between 90 and 120 for anyone who doesn't know. That's about the norm. Maybe 90 to 150 if you just ate some food, but it's supposed to be between 90 and 120 generally. But being in a coma really was interesting for me. And I actually I had died. They resuscitated me. Personally, I didn't see anything. It was a black void the whole time. I don't remember the day leading up to when I passed out. And then I just remember waking up in the hospital and freaking out because I had no idea why I was there. Yeah, I was freaking out even in the coma too, because I guess I don't know the science behind it exactly, but I know that, like, I guess you could call it a side effect of the diabetic coma. Like, it makes your brain kind of go through some type of psychosis of sorts where, like, you're trying to fight everybody and you're kind of acting angrily and violently. That can be a common thing with diabetic coma, from at least what the doctors told me. Yeah, but I mean, I'm not perfect at managing my diabetes. I'm not going to claim that. But I mean, I know a lot of tips and tricks for people who may be newly diagnosed or for people trying to understand their loved ones who have diabetes better, type 1 diabetes at least. So I'm going to talk about what it feels like to be low blood sugar versus high blood sugar. They both feel awful. With me, my symptoms for low blood sugar are usually I get really shaky first and I get irritable, and sometimes it can get to a point where, like, I can't even walk in a straight line. Like, it feels like I'm drunk almost, but like drunk and angry is how it feels for me, and shaky. Then that's me personally. Everyone's going to be a little bit different. The symptoms overlap for people for sure. There's similar symptoms, but like everyone's going to experience it a little differently. And then for high blood sugars, I just get really nauseous, dizzy. I get really hot, really warm. It just feels like nauseating and warm. Like I'll sweat, peeing a lot, drinking a lot. Those would be the main symptoms for me for my high blood sugars. And all diabetes is genetic from what I understand. Type 2 is often triggered by a personal diet or a lack of exercise from what and genetics as well. But this isn't the case for type 1, at least for diet and lack of exercise. Those are not tied to type 1 diabetes. Like I got diabetes after I was infected with a virus, and that virus is what made the T cells attack my pancreas. So there's some basic rules for having diabetes, pretty common with, like, everybody. Check your blood sugar at least 4 times a day. So like before each meal and before you go to bed. Give insulin for high blood sugars and carbohydrates. Every body is different, so dosages on blood sugar goals will be determined by your doctor. For any person, a blood sugar between 90 to 120 is optimal, although the goals may vary depending on where you are with your diabetic regimen. Like your doctor may say, let's just keep them on, like my doctor said, like, let's try to keep them under 200. That'd be the first goal. And we're eventually working towards 90 to 120, but that's a really big goal to jump from where I am now. The good times to check your blood sugars: before operating a vehicle, before meals, when you wake up, and before bed. If you start to feel lower high blood sugar symptoms in the before and after working out, and really any time is a good time to check your blood sugar, especially if you're like me. If you're thinking about it, just check it. Just check it. Like, because even if it's not before a meal, let's say you're not going to eat for 2 hours, you might forget before the meal. And it's better just to know than not to know. But obviously, you don't have to do it like every single hour, especially if that's going to be a hindrance for you. Like 4 times a day is really the goal here. For me, managing my diabetes is hard because I also have ADHD and I have other mental health issues too. When your brain isn't receiving the proper amount of sugar, when it's receiving too much sugar or too little sugar, it's going to affect how the brain operates and processes things. That is why mental health care is crucial to any diabetic, type 1 or type 2. Like mental health, I cannot stress that enough, especially really anyone with a chronic illness. Like it will be tied to your mental health, and treating your mental health is important even if you don't have a disorder. It's still going to affect your brain in a negative way if it's not receiving the proper nutrients, and if things in the body aren't functioning properly, it's going to send different messages to the brain. So yeah, I definitely advocate for mental health care for everyone, but especially for people with chronic illnesses. That's about all I had to cover for my tips and tricks, and then I think Spencer had some questions for me.
I do. Are you ready?
I'm ready, Freddie.
Okay. So we'll just go in order here. When were you diagnosed?
So I was diagnosed when I was 11 years old. So that would have been 15 years ago. Yeah, I remember exactly. It was November 2nd of 2007.
Okay.
I remember the date.
Yeah. How was receiving the diagnosis?
Yeah, so I talked about it a little bit. It really affected my self-esteem because I didn't understand what diabetes really was. I thought it made me like some disgusting old man, like I said, because
Yeah.
I only seen it on ED commercials. But the doctors were really great at explaining everything to me though. So that helped a lot.
Good.
Yeah.
What symptoms did you have?
So before my diagnosis, I think I lost at least like 50 pounds or something crazy like that in 3 months
Okay.
because my appetite was so suppressed from the high blood sugars. I wasn't eating at all, pretty much. Like I maybe ate once a day at that point. It's interesting. I was actually with my grandma for that summer when I was experiencing all those symptoms, and she's kind of old, so she didn't really understand diabetes either. But I
Yeah.
wasn't diagnosed yet, so how would she know that's what it was? But and definitely the drinking and peeing a lot too, and feeling nauseous all the time.
Yeah.
Those would have been my top symptoms.
Okay. Were kids or your peers receptive or were they mean, I guess?
They were actually really receptive to it, surprisingly.
Awesome.
Yeah, I never got bullied for my diabetes. Although, if I'm gonna be honest, I probably partially attribute it to the fact that I'm a girl. I feel like if I was a boy with diabetes, like I would have probably gotten a little bit of some like teasing for that. Like, I just feel like, I don't know, that's just how the dynamic would go.
Yeah. Maybe.
But I don't know. There's no way for me to know that because I'm a woman. I'm a cisgender woman. So
Yeah.
I'm not going to know that experience, but that's just what my guess would be. But yeah, no, people were very nice and receptive to it. They tried to help me out. The one thing, though, the one question I get every time that bothers me is, can you eat sugar? I hate that question so much. I'm so sick of that question because I can eat sugar. I just have to give insulin for it. And there's certain things like my doctor says try to stay away from, but it's not like I'm going to die if I eat it. Like it's just it might affect my blood sugar a little worse, even if I give insulin for it. But at the same time, like I can still eat it and not like go into the hospital. Like I can have cupcakes. I can have cake, I can have pie, I can have whatever sugar you have. Everything has sugar in it anyways. So
Yeah.
like I would be starving if I couldn't eat any sugar at all. And I get that because it's different with type 2 diabetics. Type 2 diabetics do typically have to avoid certain foods a lot more often because they actually have a lot, not every time, but a lot of them actually have a chance of getting rid of their diabetes through diet and exercise. That's what the treatment is more with type 2 than type. And there's other forms
Yeah.
of treatment with type 2, like pills and insulin and that kind of thing. But like a lot of it is the diet and exercise with type 2. So I understand where the question comes from, but I'm just so sick of it. Like I'm a
And
type 1 diabetic,
yeah.
so I can eat sugar.
And the difference also is that with type 2, they still produce insulin. So their issue
Right.
is a lot of times insulin resistance,
Yeah.
whereas you don't have insulin resistance. So as long as you can give yourself insulin, the sugar will be taken up by the cells. Whereas
Yeah.
in type 2, their like insulin receptors don't respond as well to insulin. So even with that insulin, even if they gave themselves insulin, it might still not help the glucose get into the cells. So it
Right. Which
probably
is
is better for them to reduce their sugar intake. I mean, everyone should be, even whether or not you have any chronic illness, you should always be cautious of how much sugar we're intaking, especially in
mhm.
America. But for type 2, they probably should consider reducing it more just with that insulin resistance, whereas you at least can give yourself insulin and it will work.
Yes,
So there is that aspect of it too.
exactly.
How was growing up with diabetes?
Honestly, growing up, it was hard because honestly though, like I for a long, long time, I would just kind of pretend I didn't have diabetes and not take care of it. So, like, I mean, actually growing up, I was fine, but once I hit like 18, 19 years old, I started having like more frequent hospital visits. And eventually, like over the past year or two, like the past year, I'd say, like I've definitely been a lot more cautious about how I'm giving my insulin, trying to be on track of it. So growing up with it, it kind of felt like it wasn't there because I was ignoring it. But like once you like as a child trying to get into that routine, any routine really, but especially like a routine that intense, like that's requires so much vigilance on your part, like it just made like I can't imagine trying to implement that routine as a child, honestly. Like
Yeah.
it's difficult, at least for me. Maybe it's just my ADHD. Maybe it's just because I was a kid. Maybe a little bit of both, but like yeah, I guess I would have had a harder time if I was actually trying to take care of it, but it would have made my time easier overall in the long run.
Yeah. And I bet there's probably an aspect of why is this fair that I have to do all this work just to take care of myself while my peers don't have
Oh,
to deal with
absolutely.
this too. So that's not really fair
Yeah, I've definitely had
from
that
that
thought
aspect
before.
either. So it's not any probably, especially when you're that young, developing any illness that becomes chronic is very life changing and
Absolutely.
it's awful. Kids should not have to experience that, but
Yeah.
that's not something we, at least right now, have the means to prevent, I guess, unless we can come up with artificial pancreases, which maybe someday, I hope.
Someone was working on that at some point, but I'm guessing the project fell off because I never heard anything about it for a while after.
Mm. And that would
That
destroy
was,
big pharma, so they're not
yep,
gonna let that
exactly.
happen. Stupid big pharma.
Yeah, I mean, they thrive off of us being chronically ill. They
They
don't
do.
want to create treatments or they don't want to create cures because then we won't buy their treatments because we'll be cured.
Did you see that tweet chain about that
Yeah.
one pharmacy who lost billions of dollars?
Yeah, because someone said they were going to give out free insulin.
Yes,
They should have just rolled with it and said, yep, we
they
are giving
should
out
have.
free insulin. I mean, the inventor of insulin wanted it to be free. He sold the
Yes.
patent for $1 and said, give this to people for free so that they can like not die.
Yeah, because people like if this isn't like maybe you could argue, oh well, people will be fine without SSRIs. Well, yeah, maybe, but insulin, people are not going to be fine without insulin. They need
I mean, yeah, yeah. I see what you're saying.
like
I
all,
do kind of disagree a little bit. I think that SSRIs are just as important as insulin for some people because like killing yourself obviously, for example, is not that every depressed person is going to kill themselves, but like when, that is a risk factor of not having the SSRI and that's just as bad as someone dying not in their own hands but because of what their body's doing,
yeah,
but it's all the same outcome. But
yeah,
insulin is like more
uh,
important for type 1 diabetics at least because it is the only treatment, whereas with depression, let's say, there's other forms of treatment besides medication that you can use.
yeah,
So I think that's why people view it a little more essentially for insulin
yeah. Because I
because
mean,
that is the only thing you can really use for type 1 diabetes.
yeah, I guess yeah. I feel the insulin is just more physiologically dependent than the SSRIs because I feel like even
Yeah.
recently there was a study that said SSRIs don't are more of a placebo. I don't remember that study, but But if
I
they
don't
help
think,
people, then I
yeah.
1000% am for it. Like anyone who needs to use it should use it, and that should be free too. But insulin is just way more physiologically dependent than
Yeah.
SSRIs are, at least
And
from my
yeah.
perspective. But and I could
Yeah.
be wrong, and that's
But I
fine.
mean, you can also withdraw from SSRI. I've
Oh
withdrawn from
yeah,
SSRIs before. It was terrible. SSRI, I'm not a fan of them for me, at least.
no,
I mean, if other people want to use them, that's fine. That works for them. But for me, they just made me really manic.
yeah, I hated. I was on an SNRI, and that was coming off of that was the worst.
Yeah. Oh my God. Coming off of those are awful.
Yeah. But again, yes, everything is important. Healthcare should be free, in my opinion. I know
Yeah.
that's a
It should be taken
extremist
out of
view,
our
so I'm an
should be taken
extremist
out of our military
apparently.
budget.
Yes. But we're extremist apparently because we think people shouldn't be dying on the streets because they can't afford
Yeah.
healthcare. That's such an
Oh
extremist view.
no. Empathy. What the fuck is
Yeah,
that?
what is that? Uh, anyways. So, next question. How were the teachers?
Um, okay. Most of the teachers were good. I did have one teacher who kept think so okay, I had this math class right before lunch when I was in like 8th grade. And this teacher, I didn't know at the time, but she was a diabetic herself.
Oh,
So she and since it was right before lunch, my blood sugar would always drop in her class, if that
okay.
makes sense, because I
Yeah.
hadn't eaten in so long since breakfast, and my blood sugar was starting to dip in her class. And it was like not every day, but a lot of days. And I had to go to the nurse's station and drink a Coca-Cola. And like that was that. But this teacher would be like, "You're faking it," or like, "Show me your blood
What?
sugar meter to prove it." And I'm like, I didn't actually check my blood sugar yet. I was gonna do that at the nurse's office, but okay. And then my mom had to talk to her to like get her to stop during parent teacher conferences. She had to be like, "You need to stop like harassing my kid," basically. Like she didn't say exactly
Huh.
that, but she got her to stop somehow. And oh, I had another teacher in 7th grade. It was kind of funny. I had my insulin pump, my Medtronic insulin pump, clipped to my belt, and he said, "No pagers in class." I said, "I need this to live, sir. I need to
How
keep
old were
this
you?
on." I was 13, I think, 12 or 13 at the
What
time.
what 13-year-old is carrying a pager?
Yeah, in what, 2010 or something?
What?
2009, 2010. Yeah, I was totally a 13-year-old carrying a pager like I'm a drug dealer, a doctor or something. Like,
Oh my God.
yeah, no, that's my insulin pump. So, I mean, for the most part, teachers were pretty good about it, but I had a couple instances. So,
I forget, were you in private school at this time when you were first
I
diagnosed?
was, when I was diagnosed, I was still, yeah, I was in Catholic school. I was in Catholic school until or through 7th grade. So, in 8th grade, I switched to public school.
Okay. So were those did you mention when were those experiences
Yeah,
in
one of
public
them was
school?
so yeah, the 8th grade teacher was in public school, the math
Okay.
teacher. They were both math teachers actually. But yeah, the one
Mm,
who wanted to check my meter, that was in 8th grade. And then the one who said it
okay.
was a pager was in 7th grade in private school.
Oh my goodness.
Yeah.
Some people, especially someone who has diabetes, that's odd.
Yeah.
Anyways, next question. How did the rest of your family respond to the diagnosis?
That one's kind of rough. The only person in the hospital with me was my mom. My dad was probably working and just not making the effort to come anyways.
Mm,
And I don't know where my brother was. He was in college doing something. Didn't make the effort to come either. But I mean, I don't hold that against them or anything. Like it, because I mean, visiting me I've been in the hospital so many times at this point. Like the only person I really care to have visit me is my mom, just because I'm so close
yeah.
to her. Like my grandma would ask like if I could still eat sugar. I remember that. Like not to me, but to my mom. And yeah, I mean, I don't know. My family didn't really react too much to it, I guess. Like besides
Yeah.
my mom, obviously, she was the one who actually thought I had diabetes and had me tested and tested my blood
Okay.
sugar and brought me to the hospital because she knew what the symptoms were. Yeah, she was the one who helped me get my diagnosis. So she was like expecting it. So that probably helped a little bit with the disappointment, but she was still feeling like, why my kid, I think is what she was feeling.
Yeah. Is your mom a cardiac doctor, right? Or
She's a pediatric cardiologist.
yeah. So she definitely, I mean, I'm assuming all doctors, like she probably had to learn about diabetes in
Oh
school late
yeah,
and
and I'm
everything too.
sure
So
most type of doctors deal with diabetics occasionally,
yeah,
because diabetics have
definitely.
a lot of other health problems most of the time, like eventually at least.
So that probably helped too, just with the diagnose, like being able
Hmm.
to understand the like she probably knew the symptoms and all that.
Oh yeah, definitely. I guess one thing that kind of bothered me though was that she was happy that I had lost the weight, because I was kind of a
Oh,
chubby kid. Like before she realized the diagnosis, like earlier on, she'd be like, "Oh, you lost so much weight, congratulations." But I mean, I looked like I was like, like a couple days from death's door. I was that
yeah.
skinny. But like, I mean, it's just our society praises skinny people, so
Yeah.
that's
The way
how it
some
goes.
people will,
Especially older generations.
yeah, that's an odd, like, yeah, that's odd. I mean, it is what it is, I guess, but it's
Yeah,
changing. I'm hoping we're getting rid of those disgusting beauty standards because
yeah,
who needs them? They're trashy.
yeah. Like, I mean, I don't get the point of judging people based on how they look,
No.
unless you're gonna like maybe hook up with them or something.
Well,
But that's the only time it makes sense. But
yeah.
like, you still don't have to be rude to people you're not attracted to. You don't have to
No.
just discard them and throw them in the trash. Like, people you're not attracted to can still be good people and can even be valuable people to have in your life. But like, you
Yes.
just, when you judge people based on looks, you just miss out on so much more that people can offer.
And it's also just so trashy and disgusting how they act like our bodies are trends. Like, oh, now the
Yeah.
skinny trend is coming back. And no, fuck
Yeah.
that. What do you
Heroin chic
mean?
is
That's
coming back.
disgusting. No,
Right.
bodies are not trend. Our bodies, we need to love our bodies for what they are. It doesn't matter
Yeah.
if it's a trend. There is no such thing as a trend for bodies. Whoever pushes that narrative is not a good person. I don't, okay,
Right.
I don't believe in that, but they are pushing a false narrative. Everybody is beautiful the way they are. Do not let somebody convince you that your body isn't good enough because it isn't trendy. Who
Yeah.
cares?
Or when
Love your
people
body
say,
for who you are.
I'm just concerned about your health. Well, you don't talk to smokers
Oh,
like that. Like,
yes.
you don't talk to smokers in the same way you talk to fat people or people you call fat. I don't like the word fat really, but just because it has such a
Yeah.
negative connotation. But like, people who they would call fat, like, they talk to very differently. Like, they try to say, "Oh, I'm so concerned for your health. Like, I don't think you should be." And just being overweight to some people is just, they think it's like promoting unhealthiness, when
It's
healthiness
not.
isn't even determined by your weight. Like, you could be extremely skinny and be super unhealthy. You could be like super big and work out every day and eat healthy.
That's
Like,
why I think genetics plays a bigger part of how our bodies look than we like to admit. Because I feel like
absolutely.
some people who may have bigger, not, I don't like just bigger bodies work out daily and they don't get skinny. And that's fine. There's nothing wrong with that. But
Yeah.
just society is like, oh, well, if you work out, you'll get skinny. Nope, not necessarily. But there's nothing wrong with that. They are okay.
Right.
Everyone needs to be comfortable. Honestly, to me, working out isn't to change my body, it's just to help me feel comfortable in my body. I mean,
Yeah. And it's to
for
show your
sure,
self
you
love.
can, yeah, exactly. And sure, maybe if I were to put in thousands of hours a week and be unhealthy, I could develop abs or something, but I don't know. That's just not like if it happens, cool, but that's not something I'm not doing it to change my
Right.
body. I do it
And
to feel
it's
good
not
about myself.
necessary.
No, exactly. So, yeah, I think the way people look at beauty standards needs to change because everyone is beautiful and worthy. It doesn't matter how we look.
Mm-hmm.
Anyways,
Preach it.
back to diabetes. My last question. How
Okay.
has diabetes affected your life overall?
Oh gosh, that's a big one. I think, let's see, diabetes has affected my life a lot. Um, I would say like I've definitely been in the hospital a lot more times than the average person my age. That's one
Yeah.
thing. I'm very accustomed to the hospital setting more than I probably should be because I wasn't taking care of myself for a long time. And like it's I mean, one this is kind of bad. Don't follow my example, but it's been a good thing sometimes like when I need to get out of something, I could just say I have a low blood sugar. Like I've done that
Oh,
before. Or like when my like if I've had a late assignment or missed a class or not shown up to work or something. I've used it as an excuse because when like my thought process at the time was just like I have this disease, it's making me so like it's just affecting me so negatively, I might as well turn it into a positive thing and like make it
yeah.
something I can use as a tool, which, maybe don't lie. That's not good. But like that's just another way it's affected my life, though, if I'm being honest. All right. I have one more story here.
Yeah.
It's it's not really relevant to the question, but I really just want to tell
That's
this
okay.
story though.
Yeah.
Like it's really quick. And Spencer, you know this story. But this so there was this guy I was kind of in a situationship with for a little bit. And, we were doing our thing and he this guy asked me, well, he asked what my insulin pump was. And I told him it was my insulin pump. I have diabetes. And he asked me if it was an STD that he could catch from me. I was like, um, no, this is over. Like, I can't. That's just a little, I mean, that's not the only reason I ended it, but
But
like, it's just, yeah, some people are just not very educated on the topic. And that's fine, but it's just kind of funny sometimes
I do
for
think
me.
though that that speaks volumes about the lack of healthcare education in this country.
And sex education too.
Yes, 1000%. So I feel that needs to be more emphasized. Just people,
Yes.
I don't know how. I don't have a like honestly, like when I first started taking nursing courses, I was like, I wish we would have been taught basic anatomy and physiology in like high school, middle school.
Yeah.
Like I think everyone should know basic anatomy and physiology, in my opinion, because we're
Yes.
all human. It affects all of us. I don't care if you
Yeah.
never go into nursing or never go into the healthcare field. It still affects you.
Yeah. Just like basic things like common diseases or, whatever people might have, common disorders people might have, like,
And
and how the body works in general too, and how it's supposed to work.
how respiratory illnesses work, so that we don't have
Oh
all
my
these
God.
conspiracy theories going around. Like
Right.
maybe if
Oh,
we all would have been taught about respiratory droplets and how masks prevent respiratory droplets, we could have maybe helped prevent a little bit of what happened. Maybe not. Maybe there's still some people who
I
have
mean,
some
that part of
wild
it's a
ideas.
logic thing too. Like people saying that, oh, this person didn't die of COVID, they died of a respiratory issue. Well, where did the respiratory issue come from? You know,
Yeah,
like people say stuff like, and part of it is just a lot. Education is definitely important, and we need to improve that for sure. I agree 100%. But then there's also just some things that like you can't teach people in school like that are common sense that you just kind of have to like hope someone else will teach them because like it's not really a school teachable thing like common sense. I don't know how you would teach a common sense class.
I don't know. I don't know if you can. Because, yeah, I don't think you could teach common sense, but even I feel like for the most part, youth is pretty receptive to information. So even if you
Oh yeah.
give them that information, they may still question things, but at least they'll have a basic understanding of how it all works. So at least I feel like it will just be harder to push conspiracy theories on the younger generations if we educate them way more because
Yeah.
they'll be more like, okay, well, I learned this, so why, like, what do you have? What is your claim that this doesn't work against this? And then that's when they get shut down and then they just scream at you. But
Yeah, because yeah, like closed mindedness, like things like racism and sexism that is definitely taught to you. Like you're not born that way,
Yes.
really. Those ideals are taught to you at a young age most of the time. Maybe
Yeah.
at an older age for some people, but
I
usually
would
when you're
say,
young, because young
yeah.
people are receptive to information in general. So you need to be exposing them to correct information, not misinformation and not like prejudiced thinking. You know what I'm like?
Yeah, I would say they're either taught to you or like sometimes maybe for someone like a misogynist, it is due to one experience and then they project that one experience to that whole
To
race.
the
No, to that
oh
whole
yeah, to the whole gender, yeah.
gender. Yes, that whole gender. So they're like, I had this one bad experience, so all women are bad. Like, but
Oh,
or
people
like
do that all the
racism.
time.
So I don't. So I do think sometimes it's taught, but I also think sometimes the people we as a society we aren't taught how to manage our emotions or our feelings appropriately. We're told to push
Yeah.
them down. So
But I do think the ideals are still taught though in those
yeah,
cases. Like, I mean, it is still something that's taught to you. It's just that's more of the experience that gets you to get on board with it. But like I
yeah,
definitely see what you're saying though, because like there are a lot of people like that out there who have one bad experience with, a woman, or they have a bad experience with someone of a different race. And they just say, well, all of these people must be like this because that's my only experience. That's also why diversity is very important for children to
yes,
experience. Like the more you can experience diversity as a child, the more open your mind is going to be to others' experiences.
100%. But
We went a little off track here, but
no, that's good. It's always good.
yeah,
But
that's
otherwise, I
okay.
think for diabetes, that was my last. I don't have any. I don't know if you have anything else that you want to add. Any last
Um,
standing points?
I think I mentioned everything I was going to mention,
Okay.
so we can have
Call
people
it
comment.
a call it a Wednesday or Tuesday.
Yeah,
Call it a Tuesday.
Tuesday. Yeah, we just gotta make sure if people want to comment, feel free to comment. You can comment on our YouTube video. You can comment on Facebook, Instagram, Twitter, and TikTok as well. Just let us know what topics you want us to discuss for any day of the week, but especially Tuesdays for our education days. And don't forget to like, subscribe, and hit the notification button.
Yes, and we will see you guys next time.